The flu sweeping the country has hospitals reeling and searching for new ways to cope with the flood of patients. Emergency rooms overwhelmed, one hospital putting up tents. At another, doctors have been ordered to wear masks. And one major American city has declared this a public health emergency. ABC's Linsey Davis is on the front lines for us tonight.
In Boston today, the mayor sounded the alarm.
Today, I am declaring a public health emergency in the city of Boston.
At Mass General Hospital, there are now 24-hour waits to be admitted. And when you do get in to see a doctor or nurse, they'll now be wearing protective masks.
What's really been a problem for us has been the increase in volume, where we're seeing unprecedented levels of both hospital crowding and emergency department visits.
It's not just Boston. One Pennsylvania hospital is so inundated with the flu, they've set up a special tent outside the emergency room to deal with those patients. And in Minnesota, where they've already had almost 1,000 confirmed cases of the flu, they're trying everything to stop the spread.
Please, we implore you to stay home when you are sick.
For up to 5 days, you may be infected and contagious without a single symptom. On day one of your symptoms, the very first sign, your fever will spike as high as 104, even 106 degrees. Severe headache and muscle pains, too.
I was feeling dizzy still, and I couldn't breathe even more. My face was all sweaty.
By day 3, add on a sore throat, stuffy nose, and a dry cough. This happens to be day 3 for Lawrence DeLoach.
I feel weak. I've never been hit by a Mack truck, but I feel like this is it.
By day 7, you're likely no longer contagious, but symptoms can persist, especially fatigue and coughing. Both can last for weeks. Yes, weeks. That's where things stand at the Petrocelli house, now entering their second week of sickness, despite their 9- and 12-year-old daughters both getting flu shots.
We've all moved on to the upper respiratory, which is a lot of coughing and a lot of tissues. It hasn't been fun. It feels like every day it's just getting worse.
There is a crowd inside the emergency room here at St. Luke's tonight. The hospital calling the flu outbreak here severe. About 20 to 25% of the patients inside the ER tonight all have flu symptoms, and flu season isn't expected to hit its peak until the end of the month, Diane.
Oh, Linsey, thank you so much, and we really feel for all of you who sent us those videos. I want to bring in ABC senior medical contributor, Dr. Jen Ashton. So, Jen, what should people do at home if they think they're feeling the first symptoms?
3 important steps for people to take, Diane, if someone in their household is sick. The first thing is starting antiviral medication. If someone in the house has a known or suspected case of the flu, probably a good idea to start Tamiflu or an antiviral medication. But again, not for the common cold. Second thing, you want to make a sick room. This is pretty much like isolation as we do in the hospital. This person should not be sleeping or eating with others. Remember, this flu virus can be transmitted up to 6 feet away, so you really want to keep that person separate. And lastly, disinfect. Wipe off those surfaces, and guess what, Diane? The flu virus really does not like humidity and sunlight. So you want to open up those blinds, boost the humidity if possible, turn up the temperature. Research has shown that that can actually deactivate the flu virus.
Let the sun shine
Absolutely.
in if you can. Thank you so much.